I'm from Preble County, from Lewisburg, Ohio. That's where I grew up. I went to Wright State University for my bachelor's degree in nursing, and I worked as a nurse at Atrium Medical Center for several years, and then went back to Frontier Nursing University for my master's degree in midwifery. I have been a patient of Premier Health since I had my first baby, and my midwife is part of Premier Health as well, and she, I've had that experience on the patient side, and then in nursing school I did my role transition at labor and delivery at the birth center that I'm actually currently at, and so my experience there as a nurse and as a student nurse, really, I wanted to work there. So my experience on the unit with the nurses and the environment of the unit and how everything was, that's when I decided that I wanted to stay and work on that unit. And so I applied, and I've been there ever since. Midwives take care of women not only during pregnancy and delivery and postpartum, but we can do annual visits, well exams for women, gynecological care, all through all of the life stages, from teenage all through menopause. I would say my philosophy of care definitely revolves around family-centered care. So a partnership with the patient and her family, really getting to know my patients is very important to me, and meeting them where they're at in their life now and what kind of support that they need and what they need, as in my personal experiences, my needs of pregnancy in my very first pregnancy compared to my needs in my last pregnancy were very different. And so I loved that about my midwife, and that she was able to provide that support no matter where I was in life. And so that's important for me to be able to do, to spend the time, learn my patients and what they need, answer all of their questions, really go through all of the evidence-based things that we need to do, but present it in a way that empowers them to make their own decisions and help come up with a plan of care that is specifically for that family, and just being there to support that family in that way. I would say that a patient, the benefits of a patient coming here, our office is very easy to get into and make appointments to see us. We have a lot of open availability, and depending on what they're coming for, we have all of the resources that we would need. We work really closely with our physicians, so if it's a patient with higher needs, we can easily, manage care with them with our physicians. We also have the birth, side of it too, or we as midwives will support them during their labor and birth, and we have the birth center, which is a really, we have a lot of patients that travel from really far to come to the birth center and have that experience with us. And we have a really great team. We work really, really well together, and things flow really well. And I feel like overall, patients have a really good experience in our office, both in our office and in the hospital.